Well, good morning and welcome everyone to this California Department of Aging All-Stakeholder Quarterly Meeting. My name is Adam Willoughby. I'm the Assistant Director for Legislation and Public Affairs at the department. Before we move into the body of our agenda, I'd like to cover a few logistical items. The first, to prevent background noise, all participants' lines will be muted. There will be a question and answer portion at the end of the agenda for attendees to ask questions. To be put in the queue to ask a question, either press *9 on your telephone keypad or click the raise hand icon in the Zoom platform. The moderator will inform you when your line has been unmuted. If we are unable to get your question, please do email us at olpa@aging.ca.gov. This presentation, along with a transcript of the meeting, will be posted to CDA's website in the near future. This presentation is also being live captioned. Now, before we jump into the agenda, I'd first like to introduce CDA's executive team and then go over what we're going to talk about today. So first of all, as many of you I'm sure know, the Director of the California Department of Aging, Kim McCoy-Wade. The Chief Deputy Director of the department is Mark Beckley. The Deputy Director of our Aging and Long-Term Care program is Irene Walela. The Long-Term Care Ombudsman is Joe Rodriguez. Deputy Director of Administration is Thomas Cameron. Yours truly, the Assistant Director for Legislation and Public Affairs, Adam Willoughby. And then finally, Master Plan for Aging Project Director, Amanda Lawrence. So moving on to agenda items. The first item we will address is CDA's COVID-19 response. And this is going to include what we've done to redesign our services, advance equity, and continue to meet the needs of California's older adults and adults with disabilities. This item will be presented by CDA Director Kim McCoy-Wade. Next item will be a Master Plan for Aging update. This will be presented by Master Plan for Aging Project Director Amanda Lawrence. Next will be a budget update presented by Deputy Director of Administration Thomas Cameron, followed by a strategic plan update presented by CDA's Chief Deputy Director Mark Beckley, followed with a question and answer session. So with that, thank you all again for joining us. And at this time, I'm very pleased to introduce CDA Director Kim McCoy-Wade, who will take us into the first agenda item. Kim.
Thank you, Adam, and thank you to the 150 people who've joined us today. We are going to do our very best to shine a bright light on all the work that we are doing in these challenging times with you and for the people we serve, and then get to questions and answers. Before we start, we just absolutely have to ground ourselves in the moment, which is, of course, the pandemic. With its huge impact on all Californians, and particularly older Californians and people with disabilities who have higher risk, and our families and our loved ones. As always, these are your go-to websites, so if you miss anything, don't worry. The covid19.ca.gov is your one-stop shop for all things COVID, and our website, aging.ca.gov, for all aging and adults information. And then we have our very public-friendly Engage CA is another landing page for the general public. All are there for you with this information. But let's start with the data. Very sobering right now, as we know, cases and deaths are spreading across California. And the largest impact of, not of cases, if you look at this chart from CDPH, California Department of Public Health, this is a chart that has age groups and then the number of cases, the percent of cases, the number of deaths and the percent of deaths. You see that cases are much higher in younger adults. However, because of the risk of serious illness for older adults, the deaths numbers are concentrated, particularly over 65, but particularly over 80. California has had a tragic loss of life of 7,039, and 3,142 are people 80 and over. As you see in that next to last column entitled percent deaths, that's 44.6% of the deaths, despite being 3.9% of the population. So there is a tremendous toll of loss of life that is front of heart and minds here at CDA and all of us in the administration. We're also aware in the next slide that this is not hitting all communities equally. If you look at this slide from CDPH about race and ethnicity, we can see that the cases and deaths are disproportionately impacting Latinos. If you look at that's the first row going across, you can see that the percent of case, 41%, and percent of deaths, 45.8, is double the percent of the population, 21%. If you look at African American line, the fourth line down, again, the percent of deaths all the way over there is 10.7%. This is among 65 to 79-year-olds, this chart, double the percent of the population. So we've got issues here around systemic racism and health inequities that have led to these disparities. And we also have issues around living in households where there probably are essential workers who are having to continue to work for economic security and possibly at more risk of infection. So lots happening here driving these disparities. And the next final chart I'll show you just to ground us in the data and the lives we're talking about is the same chart by age and race, but this time looking at 80 plus. And again, you can see the disparate impact Latino elders over 80. You can see it with the death rate of 30% of the deaths of people over 80 are Latino when they are closer to 20% of that population. A similar disparity strikes again, striking for African American at 8.4, nearly twice the California population of 4.8. There are other concerning trends for sure in Asian American, particularly subpopulations, in some of the smaller pops that are harder to pull apart, the Native Hawaiian, other Pacific Islander. So our colleagues at CDPH are monitoring that closely. So against that context, I know everyone is tracking the new guidance from your local and from our state. We are all wearing masks, washing our hands, and keeping our distance as much as possible, all ages. Knowing your risk, knowing your setting, but wear that mask, wash your hands, and keep your distance. New information from the state, I'll just remind everybody about statewide indoor business closures and new testing priorities announced yesterday by our secretary. We would ask all of you as influencers and network leaders to please continue to share the public health information that's available from the COVID-19 toolkit. We really appreciate all you're doing. You are trusted messengers along with the public health leaders. And so thank you, thank you, thank you. Okay, what have we done at CDA? We've really focused on 3 strategies. One, which many of you are on the front lines of doing, and we thank you so much. I have the privilege of sharing the great work of Irene Walela and Joe Rodriguez at CDA to redesign and expand our services. We've also really tried to engage the public in getting information out around what's happening. And then we've had the tremendous opportunity to strengthen partnerships, which is always a key role for aging. There's a lot of content I'm going to roll through very quickly. It's on our website, on our full Aging Matters newsletter from April. It summarizes a lot of this, but I just want to briefly highlight how we are redesigning. One thing that has been clear for us in aging is that we have known that our congregating and gathering and being on site is not going to happen for a long time. So we might be ahead of other sectors in redesigning to continue services, thanks to the tremendous leadership of so many of you. So let's go through it. At CDA, we work in 5 program areas. We do food and nutrition, health at home, information assistance, engagement and isolation prevention, and residents' rights and long-term care facilities. We do so much more, but this is a high-level look at those 5 topics. I always know that I'm leaving out elder justice and other critical issues, but these are the 5 we're going to focus on that have been our significant funding and significant redesign. We are very fortunate that federal funding came through early and twice for these aging programs, recognizing the unique risks of older adults and those underlying conditions. Families First Act provided $25 million that has been dispersed in April to the Aging Network, and the CARES Act provided another $87 million for nutrition and other services that will be distributed by the end of July. We have a questionnaire in the field right now to our local aging networks about their needs and their plans for that money. So food and nutrition, you can see at this chart, which is on our new COVID dashboard, I'll commend to you, meals grew significantly from small numbers, 493 thousand a week, up to a high of 730,000 in May. You see the fall off in the more recent, that is purely a data reporting issue, and our team is working with our locals to make sure we have the most recent data. We don't believe there's been a drop in meal service like that, given the Families First funding and given the responsiveness of our network. So we'll be working to continue to update that data. But you can see that increase of closer to 500,000 to closer to 650 plus is a huge increase that we are sustaining, although concerned about how long we can sustain that. At Health at Home, we have two flagship programs. Community-based adult services, sometimes known as Adult Day Health, was one of the first to pivot to temporary alternative services, moving to the sites closing by and large, but telehealth, doorstep, and in-home services with occasional in-center services as needed. Wellness checks are happening for folks at least once a week. Providers are available 6 hours a day, and ongoing care coordination, targeted interventions to keep people healthy at home as needs emerge, and delivery, food, hygiene, medical, all things need people to stay healthy at home. Our multi-purpose senior services program also, this program serves more of our more older, usually more frail, more homebound population, completely telephone and video conference, been able to help with more COVID supplies like antibacterial soap, disinfectant wipes, masks, and no reduction or termination of services at all, serving about 10,000 people statewide. Information assistance has seen a similar boom. People need information, so we upgraded our long-standing information line, which forwards to your local aging agency, 1-800-510-2020, agingdca.gov. But we knew we had to do more to reach out, so we developed a resource card that we'll talk more about in a second. But the important part was the resource card, that there be numbers that you can call for help, whether it's for food or for health or behavioral support or adult protective services, our Alzheimer's partners. So really gathering together all of our partners and making sure their numbers were ready for the influx of calls and helping where we could was a huge part of information and assistance. Engagement and isolation prevention. Perhaps no issue aside from food has reared so large as how do we physically isolate without socially isolating? Isolation was already a challenge, if not a crisis, in older America, and only aggravated by this. Immediately, we were able to partner with Institute on Aging and expand the Friendship Line, which had already served the Bay Area, to serve all of California. 1-800-670-1360 to reach out and get a friendly line. We urge you to promote this, particularly as the pandemic continues. And we also have a Feeling Good and Staying Connected activity guide I'd commend to you for someone you love in English, Spanish, and Chinese, a way to stay active, stay engaged, stay connected to purpose. More to come on this front. The digital divide has also been enormously important. We all know that to be connected to telehealth, to social connections, to community engagement, to delivery services, to our churches and congregations, to exercise classes, digital divide is key. And so we have begun work in this area with 2 webinars featuring local stars from San Diego and the Bay Area, Oasis San Diego and SF Tech Council, among others, and are working to get more resources out to our network on the 3 legs: broadband, devices, and onboarding and ongoing support. Of course, we also know that this has been hard on friends and family. Many older adults are either living with their family or are not living with their family, both of which are presenting new challenges in this pandemic. And so grateful to the partnership with the Alzheimer's Association for the Caregiving Call series, run in English and then again in Spanish and Mandarin, and all recorded. So if you haven't heard, again, caring for an adult in your home from afar, planning for care, serious illness, palliative care, advanced care directives, self-care, my favorite topic these days, and then of course grief and loss. We know that that's hitting so many of us. Commend those to you. And fifth and final, but not last, of course, our 5th service that's been redesigned is the long-term care ombuds. From the very early days, not able to go into facilities to meet with residents, but absolutely working by phone, email, video conferencing to address concerns. And I know, as many of you know, the phase 1 of re-entry guidance was released June 26th, in sync with our partners at Public Health and Social Services on visitation in SNFs, skilled nursing facilities, and residential care, recognizing the important role of family caregivers, of ombuds, and needing to balance that, of course, with the public health concerns. All of that and more, again, our data dashboard just stood up for the COVID response, can help you keep tabs on where the services are and how we're continuing to serve in new and different and expanded ways. The second piece I want to briefly touch on is the public engagement. Again, as I mentioned, the check-in campaign, making sure really that calls were happening in two ways. That calls were happening out to older adults and people with disabilities to make sure they're okay. And also that if they needed someone to talk to, needed some help, there were ways for calls to go in. So this resource card has been developed. It's available digitally, but we've also distributed it in many other ways. And of course, it's been translated into 5 languages: English, Spanish, Chinese, Vietnamese, Korean, and Hmong. So 6 languages total. So I encourage you to download and use as you can. I'm so pleased that in the first month, 1.7 million check-in calls were made. That was replicated again in the second month. That's the calls we know of. And those are calls being made by nonprofit groups, by health plans, by volunteers, the Village Movement, of course, congregations calling their members, neighbors, meeting neighbors. So many, but those are just the calls that we were aware of. And again, more and more people have taken this torch up and are running with it, and we're so grateful. We also partnered with DMV to mail the card to 2.1 million Californians over 80 who were on file with DMV, whether they had a license or not. That was our mailing list, and that went out in May so that people have these postcards and hopefully have them on their refrigerator and know who to call, again, for a range of issues that may come up during the pandemic. For all of these resources and more, again, we're trying to keep it publicly accessible at engageca.org, how to stay connected, how friends and family can get support, and how to find info and assistance. Another big piece for us, of course, is remembering and highlighting that older adults are contributing during COVID-19, are the subjects of their story, have purpose, have connection, have engagement. Yes, there's higher risk for health, but they are also champions every day, not just staying home, but making their mark. And we were very lucky that the National Older Americans Month theme was Make Your Mark. So we got, I always say a number and it's wrong, but I'll say 30, and Amanda will correct me, dozens and dozens of videos from older Californians in multiple languages telling their story of volunteering, of caregiving for grandchildren, of making music for neighbors, of gardening to produce extra food for the community. So many ways that older Californians are making their mark and leading the way. And we know that we need to provide more resources. So we've just launched a new page for Native American older Californians with tribal resources in partnership with tribal groups, always looking to expand and add more. So please let us know if there's more and different you'd like to find at our one-stop shop. Lastly, in terms of COVID response, as I mentioned, aging only works if we work in partnership, because aging is everybody and aging is everywhere. So we've been so fortunate to have great partners on multiple issues. I'll just list a few here. Of course, the check-in campaign I've already mentioned, and if I left you off and you did it, thank you. Cal Volunteers out of the governor's office, Listos California out of the governor's office, AARP with their own postcard mailing and radio ads, Alzheimer's Association with the caregiving call series. The State Council on Developmental Disabilities is doing their own check-in campaign, just amplifying. So thank you to so many partners. The crisis care guidelines, what to do if there is not enough resources in a hospital. We work very closely with the Department of Public Health and many stakeholders to issue a new version of that in June. I commend you to it. It is not, it is guidance out to health systems and hospitals about how to do triage if needed. And we're pleased to be engaged in bringing that draft to a more equitable and non-discriminatory place. COVID dashboards, we've worked very hand in hand with CDPH for our shared goal of age and race. Congregate care, again, it's a 3-way partnership with CDPH over SNFs and social services over residential care. Many of you are also involved with the new long-term care at home benefit proposal with the Department of Healthcare Services and the Digital Divide Initiative, more coming soon through our work with the California Department of Technology. Just want to do a shout out and thank everybody for their work on all of those. With that, I will pause and thank you for letting me run through all of that work. We wanted to also, this has really been the focus of our work the past quarter, and of course will be the focus of our work ongoing, but yet our other responsibilities continue. And so one of the most important ones there is the master plan, and I'm going to hand it over to Amanda Lawrence to give an update on where we are. As many of you know, we paused that in March with the governor's stay-at-home order for older adults, March 15th, but we resumed it in late May. repurposing it for the moment, making sure we hear the lessons, and making sure we acknowledge how much time and energy we're all spending on COVID response. So Amanda, the update, please.
Hi, good morning, everybody. So yes, just over a year ago, the governor signed an executive order calling for the development of a master plan for aging that would ensure that California is prepared for our growing older population and to ensure that California is an age-friendly and disability-friendly state. So this master plan, or MPA, will serve as a blueprint for state and local government, as well as private, nonprofit, and philanthropic sectors to implement strategies and partnerships that promote healthy aging and prepare for that coming demographic change. And it will be released, as Kim said, by the administration in December of this year. And I'll share a bit more about that timeline with you in a moment. But if you're not familiar with the master plan, we'll also share the webpage with you in a few minutes where you can catch up on all the information, including our stakeholder input process, our stakeholder rosters, public process, meetings, presentations, timelines, everything. But somewhat recently, the master plan has partnered with the Governor's Task Force on Alzheimer's Disease Prevention and Preparedness. And this has proven to be a very natural and mutually reinforcing alignment for us. And we're confident that this partnership will ensure that the master plan for aging has a robust set of recommendations that will assist government, business, and private sectors, as well as families and caregivers in preventing and preparing for caring for those with Alzheimer's disease and related dementias. And then today I'll also share with you our latest effort, a campaign to combat ageism across California. But first, next slide, we'll take a look at the updated master plan for aging timeline. Go ahead and advance that. Okay, so here we see, as indicated, June 2019, the governor signed the executive order to create the master plan for aging. And then moving forward in August, we created a stakeholder advisory committee, and it's comprised of over 30 experts in the aging and disability services field, as well as additional experts that also serve on a long-term supports and services subcommittee and a research subcommittee. And these stakeholders are responsible for drafting the master plan for aging recommendations that we will then submit to the governor later this year. In March, the long-term supports and services subcommittee completed its report to the governor on stabilizing long-term services and supports. But in May, an additional COVID-19 response and lessons learned component was added to that report. Additionally, in March, we formed an equity work group, and that work group was formed to ensure that an equity lens is applied to all the forthcoming master plan for aging recommendations coming out of our stakeholder advisory committee. Moving forward to March to May, over the past few months, MPA has focused on COVID-19 rapid response and working to incorporate all those lessons learned into our master plan for aging recommendations. And currently here, June to September, the Stakeholder Advisory Committee and the subcommittees and the Equity Work Group are drafting recommendations, and we're incorporating the public comment that's been collected over the past several months, which we will then share with the governor in October, which brings us to that blue arrow at the end, when the governor will take our recommendations and in December release the administration's final master plan for aging. Go ahead and go to the next slide. This slide features our these are our remaining public meetings for the master plan for aging. These are what we have scheduled. And so we have 6 or 7 more meetings, and we also have there in July, you'll see on the 29th, our Aging and Equity Town Hall. I'll talk about that, but just want to note that Tuesday, September 15th is our final Stakeholder Advisory Committee meeting. And throughout the next 2 Stakeholder Advisory Committee meetings, each work group and subcommittee will be sharing their recommendations for adoption by that Stakeholder Advisory Committee body to put forth to the governor. Go ahead and move on to the next slide. So we're very excited about this, our new initiative to combat ageism and promote equity across California. And we are launching our initiative on July 29th, so it's just about 2 weeks away, 10 to 11:30 in the morning. We'll be hosting a virtual town hall, and it'll feature several expert panelists who work in the aging and disability fields and who've had a lot of experience in combating ageism and messaging and working with people, so we can really confront our internal ageist attitudes and build a much more age-friendly community, state, workplace, city, you name it. So we're very excited about this. And then in August, we will launch our Combating Ageism California for All Ages campaign. So look out for that. We will start promoting that a bit more, and you can also find the link to this on the website I'll share in a moment. Then another recent initiative we took, next slide, is to incorporate lessons learned and the impact from COVID-19 into Master Plan for Aging recommendations, and as well as the California Department of Aging. And so just last Friday, we released a survey, a COVID-19 survey. This is available to the public, and it is in English, Spanish, and Chinese. And what we're really trying to do here is learn from people, how has COVID-19 impacted your life? What services did you find to be helpful in coping with COVID and coping with, say, isolation or bridging the digital divide experienced by so many people? And then what would help people, what would have helped you, or what could help you in the future in surviving and getting through COVID-19? As well as we request recommendations for the Master Plan for Aging. So this survey is going to run through July 24th. And again, we'll share that website with you, where you can find the link to this survey in just a moment. But we really encourage everyone to share that out with folks and to take it yourself. And then we will go ahead and share those results and share them not only with the public, but with our Stakeholder Advisory Committee for the Master Plan. And next slide. Go ahead to the next slide. Okay. Recently, our equity work group, as I mentioned before, our work group was created in March. And they were formed to ensure that we really, truly do ensure that our Master Plan for Aging is for everybody, regardless of race, sexual orientation, gender. And so this work group created a tool, and the tool is featured up on the slide right here, and it will soon be available on our Master Plan for Aging webpage. So you can adapt that and incorporate that into your own work as well. But essentially what this tool does is it sets forth a definition of equity for our Stakeholder Advisory Committee, has also identified a set of equity principles, and then it offers 6 questions that can serve as a guide as our Stakeholder Advisory Committee members create and design their recommendations. So it's a nice review process to be looked at in tandem with creating these recommendations. So it's an excellent reference to have. So you can access that. If we go to the next slide, engageca.org. This is where you can find everything about the Master Plan for Aging, and you can access our recordings to all past meetings, to our webinar Wednesday events. Several reports are up there, and this survey is there as well, and the equity tool. And I am going to go ahead and hand it back to Kim, because those are my Master Plan for Aging updates.
Thank you, Amanda. I hope people can see that we are back in business, retooled to be laser focused on the challenges that have been elevated and engaging with you all in ways that are sustainable and meaningful. So thank you so much. I see a few questions coming in, but we're going to hold them. We are almost through our reports. So I will hand it over next. I believe we're going to do a budget update with Thomas Cameron.
Hello all. So I just wanted to briefly go over the recently enacted budget. As everyone knows, the governor and the administration came to an agreement on the 2021 fiscal year budget, which is drastically different than what was proposed in the May revision. What that means for CDA is a couple different things. One, all our programs do remain intact and funded at or in some cases slightly above prior year funding levels, with no major program impacts or changes. And you can see that as displayed on the slide, which is a budget summary table that's actually taken from our CDA budget summary doc, which will be posted to our main web page under the highlights section towards the middle bottom of the page. In that document, you will also notice some technical adjustments to our budget in both our federal fund levels. We were able to get some additional budget authority for our MIPA, or Medicare Improvements for Patients and Providers Act grant program. And we've also received some general fund increases associated with the relocation of CDA's office to a new, healthier, safer facility. Again, the only other major changes, as you can see, to our budget from the summary table is the receipt of the emergency federal funds associated with the Families First Act, as well as the CARES Act. Please refer back to the budget summary with any additional, for any additional specifics or information. And again, it'll be posted on our main page, which is www.cda or aging.ca.gov. Right there on the main page under highlights. And I am handing it back to Kim.
Thank you, Thomas, for that succinct and accurate summary. I want to thank all of you. It's a very, one of the many impacts of the pandemic, of course, is the economic impact on families, on communities, and on government at all levels. And so this has been a very tough budget season. We know there were extremely tough proposals for our community, and we are grateful to everyone who pulled together to have us where we are now. Of course, we're not through this, and there will be ongoing budget conversations and decisions in tough moments, and so we will continue to face those together. I do want to turn now to very briefly our strategic plan. I know people sometimes think, gosh, how can there be time for a strategic plan when there is so much happening? But that's kind of precisely why we're doing it. We know that CDA needs to be a new CDA, and our particularly our aging network and our home and community-based services partners need to be stronger than ever, both to drive the vision that we all have in the master plan and to respond to the unprecedented crisis of the pandemic. So this planning is meant to be nimble, it's meant to be focused, but it is really meant to leap us forward so that we can build the new world we all need to come out of this. So with that, Mark, can you lead us through our work with Sac State?
Absolutely. Good morning, everybody. So the strategic plan, some of you have already seen the strategic plan. We did reach out to our stakeholder groups for their input and feedback in terms of our draft strategic plan. A lot of your ideas and comments are definitely captured within this revised plan. And, you know, this really constitutes what we consider to be our final plan. So I'll briefly go through the different elements and components of the plan, starting off with our vision, which is transforming aging for all Californians. We wanted something that was going to be bold and inspirational to people who are viewing the plan. We think that transforming really does capture that in terms of the work that we're doing with the master plan for aging, as well as the internal work that CDA is doing to improve services, supports, and quality delivery to all of our customers. For our mission, this encapsulates what CDA is responsible for doing. So we are leading innovative programs, planning and partnerships, really with the goal of increasing choices for our customers, ensuring that all of our work has that foundation of equity underneath it, as well as, of course, improving the well-being for all Californians as we age. In terms of core values, we are person-centered, meaning that at the heart of everything that we do, we always look at the impact to our customers and the outcomes of our work. And we're doing that in close concert, of course, with all of you, and that we have a way of measuring what our impacts are. So we're looking for data-driven dashboards and a way to measure our work. Leadership and collaboration. So we do want CDA to be established at the state level as a leader on aging and disability issues, and that we are strong advocates for aging and disability issues. And that, again, we're doing this in close concert with all of you, with the goal, of course, to improve the lives of older adults and ensure that there's livable communities throughout California. Innovation and inclusivity. We're always looking to improve. We're always looking for new ideas of how we can do our work better. We turn to all of you for the innovations that you're doing at the local level. We look to our partners in other states, to the federal government, but always seeking to improve and to ensure that all the work that we do is inclusive, that it's always centered on the needs of our older adults and individuals with disabilities, and that we're also ensuring that there's equity and we're taking diversity into consideration in the work that we do. Next slide. Okay, so how are we going to do this? So the goals that we have outlined for 2021 is one, of course, lead the master plan for aging, as Amanda had gone over. This is a 10-year plan that focuses on improving the services that we deliver over the next 10 years. We will have the plan completed by December 2020. And then after that point, using data dashboards, our toolkits, we'll begin implementing and measuring the progress on implementation of the plan. The second goal is delivering quality services that increase choices to live at home and the community as we age. So in this arena, we're looking at improving our nutrition delivery services, isolation community engagement, as Kim had mentioned, some of the check-in campaigns we have, digital divide initiatives, health at home. So we are collaborating with the Department of Health Services on long-term care health at home benefit, but also just looking at, services that we're providing, such as through our MSSP network. And then, of course, creating a strong backbone and foundation in information assistance, establishing a strong no wrong door system through our ADRC system. So, continuing to build upon those networks. Number 3, delivering quality services that increase well-being of residents and nursing homes and other senior living facilities. So continuously improving the work that CDA does and collaborating with CDPH and DSS in terms of services delivered to individuals in nursing homes and in RCFEs, as well as the work that our ombudsman does in terms of responding to complaints and incidences of abuse in our nursing homes. Goal number 4, engage around the public around age. So as we talked about, ensuring that we've got active ongoing conversations around ageism, advancing equity. Amanda had highlighted some of the initiatives we have in that space. And of course, creating that strong information and assistance network to ensure that people are kept up to date in terms of the latest programs and services that our aging network has to offer. And then finally, modernizing CDA for our public partners and employees. This certainly is an important initiative. In this space, what we're looking at is, relocating our facility so that it's accessible to our partners, creating a strong client relationship management system so that we can track the data and look at and have good data to inform the services that we provide, and always seeking to improve, streamlining our processes, administrative processes, fiscal processes, so that we can really focus on delivering quality services to all of our partners. Okay, next slide. And then these are just some objectives that we have outlined for the upcoming year. So building upon our COVID response, we've seen great work done by our AAA network in terms of expanding food and nutrition. I mentioned the long-term care health at home initiative, the isolation prevention initiatives that we've previously spoken about, and getting the ombudsman back into the facility so that they can, ensure that individuals in residential facilities are being cared for. Advancing California for all ages, so expanding education and outreach to the community about aging, anti-racism, ageism issues, and ensuring that the services that we deliver are culturally competent. And then finally, strengthening the foundation of our aging and disability network. So what we call our AAA CDA 2.0. I mentioned creating an enterprise solution to capture data and metrics about the services that we deliver, looking at the structure of our programs, making sure that they're set up to really deliver the services that we need them to deliver, and then streamlining our monitoring and compliance and planning structures so that we can be more nimble in the work that we do. So that's an overview of our strategic plan. I will hand it back over to Kim.
Thank you, team. And we have hit our goal of wrapping up a whirlwind tour of what's happening at CDA with, we hope, plenty of time to hear from you with your questions, your feedback, your priorities. We've got about 20 minutes and I see 3 hands already raised. Maria, I'm gonna turn it to you to remind people how to ask a question and to facilitate this with me.
Sure, absolutely. So if you're joining us via the webinar platform, Zoom, you can click the raise hand icon. It should be located on your bottom toolbar, and that will indicate to us that you'd like to ask a question. We'll unmute your line and we'll let you know when that's happening. And if you're joining us by phone, you can press *9 on your keypad. And again, it will just let us know that you have a question. It'll add you to the queue, and we'll sort of announce the last 4 digits of your phone number when it's your turn. And you may also email your questions to olpa@aging.ca.gov. It looks like first up we have Debbie Toth. Debbie, your line's unmuted.
All right, can you hear me?
Mm-hmm.
Woo woo. Hi, everybody. First, I wanted to just say thank you. I think that in all of the beginning, and I will say as a disclaimer that I was distracted a couple times during the presentation, so I may have missed it, but as you were doling out the gratitude for everybody and all the partners, I think there was not a thank you for all the internal stuff that the Department of Aging has done to communicate effectively, the creation of the newsletters, the website, all of these things that have been lifted up to help people know where you are and what you're doing have been an incredible resource for me when people ask what's going on, and I can point them to a website and I can point them to a page. So I just wanted to share my personal gratitude for that. I know that you're all working round the clock, and I truly appreciate that. I also like the update on the strategic plan and was heartened to see that the master plan is included in the ongoing sort of refining of it and monitoring of it and adjusting it. I really also just want to thank you for the focus on a campaign, statewide campaign to combat ageism. I think that we cannot say strongly enough how that is the underlying root cause of everything we're seeing today. The deaths that we're seeing, the spread that we're seeing, the impact on our population is a result of ageism, and ageism intersecting with racism, and not having invested in and paid attention to the knowledge we had around social determinants of health. And I think I saw all of that in everything that you presented today. And I just wanted to just elevate my gratitude for all of that. And I look forward to working with you and a gazillion other stakeholders, because a lot of people are super interested and super involved in making sure that we get this right. And when we don't get it right, that we can acknowledge it, and we can adjust it, and we can improve. So thank you. That's all I wanted to say.
Thank you, Debbie. Next we have Dev. Dev, your line's unmuted.
Thank you. Can you hear me?
Yes. Mm-hmm.
Yeah. Thank you, Debbie Toth, for saying a lot of what was on many of our minds. I want to offer gratitude, but I also have questions. My name's Dev Berger, and I've worked on aging issues since 1975. And I'm very pleased to know that we are going to have, as Debbie pointed out, ongoing efforts with the master plan. I want to ask some questions. I see and I applaud that we're having a COVID survey. What I do not understand is, since ageism is really behind many of the problems and many of the problems that existed with COVID-19 in California and across the nation, why don't you have a survey on ageism? I think that that's absolutely critical for people to share the issues that they've had. So that's one of my first questions. My second question.
Do you want me to answer that? Should I hear them all, or what's best, Dev?
I think it's probably easier for you and me if I hear your answer on that. Thank you. And then I'll go to my second.
Yeah, the COVID survey absolutely has questions about ageism and racism embedded in it and people's experience with that. And we ask for those stories. So take a look at that. And if you think more or different is needed, we'd appreciate that. And as we get the responses from people, we may well want to do another one specifically just on that beyond COVID. But ageism is absolutely a central part of our COVID survey.
Thank you so much for that. That puts it in perspective. There's a second thing that bothers me. I've been involved with state reports for 20, 30 years because I worked in state government for several decades. And one of the things that I do hope will be in both the strategic plan and the master plan, most importantly, is that we have a brief history related to the impact of ageism on what's going on now, not just COVID, but the budget and legislation. For example, we know that there were efforts to have a public health guideline that would have had younger people as a priority. And I understand, you know, why things like that can happen, but it was very ageist. There was pushback that stopped it. There also was an article in the Sacramento Bee that the budget was ageist. And there were various other very current issues that use the word ageism, and in some instances, rightfully so. We also know that people had to fight to save CBAS and MSSP. I think if you don't, in a very summary fashion, and I'm not trying to be negative, if you don't put in the history of what's been going on, a lot of this loses context when people provide information. So my strong recommendation is that we have a fair, honest summary of things that were considered ageist during this COVID period. Again, whether it's the budget, whether it's legislation, whether it was, you know, state agency actions that did or did not take place. Because without that, again, I think we fail to address the issue adequately. So that is something that I hope will happen. The third thing that I'm a little confused about, and I hope that you'll provide some clarification, is there's going to be on the 29th, as you stated, I'll turn that off. There's going to be a town hall meeting on ageism. So I guess where I'm a little bit lost and ask for your help is, I'm most grateful that you have an equity work group. I was really thrilled to see that. Who are we really directing our recommendations and statements to regarding ageist issues and recommendation? Do we steer it to that equity work group? Do we steer it to the master plan? What's best for you?
Great. Both of those questions are really helpful. I love your idea of a history section in the master plan. We have such a, as a new director, been here a year, I have just relished the history that I've known from being in Health and Human Services in the state for 20 years and the history that I have learned from my colleagues. So I think that is a really insightful suggestion, Deb, and we'll think about how to include the voices of people who've been living that history since the Older Americans Act, the Older Californians Act, the Mello era. There's a lot there. So I think that's a really profound addition. So thank you for that. And welcome your ideas for how to do that. But thank you. We only go forward if we do know our history. So I deeply believe that. On the issue of the ageism town hall, it's a great question. All recommendations can always come in to Engage CA, that email address, and we will route them both to the master plan SAC, to the equity work group. We try to practice the no wrong door. We're at an interesting point here, I'll be candid, that we are both trying to inform a thoughtful plan that the administration will release in December. And we're also trying to not wait. Things are too urgent. So we are both taking all advice and input to put into that far-reaching 10-year visionary master plan that the administration will release in December. But also if there are pieces that CDA can start moving forward now, we are. And that's where the Ageism Town Hall in July is coming from, is we don't want to wait to plan on that. We want to start doing it, even if it's not as robust and as full and as comprehensive as we know we need to be. We are balancing that need for urgency with the need for a thoughtful plan. So send it into the Engage email. We will take it. We will include it both for the master plan, but we are absolutely applying a lens of what can we take action on now.
Thank you so much.
Thank you, Deb. I think next up we have Rose Marie. Rosemary, your line is unmuted.
Can you hear me now?
Yes.
Thank you. My biggest concern is the enforcement of the existing laws and possibly maybe making new laws in the oversight of the RCFEs and other facilities that house our aging population. Because I think, speaking from an ombudsman perspective, what we hear in California, in San Diego, where we have a really robust ombudsman program, is the frustration with the ombudsman that when they report non-compliances in these facilities, it takes much too long to address them, and there is very little oversight of the operators of these facilities, which are mostly private. So I don't see anything in your plan, and I'm wondering why that is.
Yeah, thanks. It absolutely is a huge part of the master plan, because the master plan is all things aging and is cross-department. And I would echo I think many of us who are part of the master plan process would agree that in the recommendations to date, that they have focused more on home and community-based services as a primary goal to allow people to live in their home of choice as long as they want and thrive there. And I'm pleased to say, I want to thank the community. We did just receive a new set of recommendations for the master plan from a distinguished group of geriatric experts of all fields. Marty Lynch is one of the people who was part of that effort, who's also on the master plan stakeholder advisory committee, but people like Charlene Harrington and Louise Aronson, Susan Carpenter are all part of that effort, and they are briefing the secretary tonight on their recommendations. I don't know if we just received them, so I'm not yet sure if they're posted on the our site listing all the recommendations we received. If they are not yet, that is in progress. So you will all be able to see those 22-page, I believe, recommendations on nursing homes in particular, but residential facilities broadly. So absolutely, that's going into the master plan, and as well as with that lens, as I said, of what's for the 10-year plan and what also can we get started on right now. If you didn't see it in CDA's strategic plan, it's because, again, the program that we run in the residential space is only the ombuds. And I welcome, we are looking at how can we strengthen the ombuds network in partnership with the ombuds network and Lisa Coleman and that community. So welcome suggestions for that. I think there are many, we're looking at other states, how they run their LTCO program. We are open on that. So that's our lane. And then again, the new coordination with CDSS over residential facilities, and I shouldn't say new, deepened and strengthened coordination with CDSS and CDPH over SNF, so that we're all walking together. Again, you see that, some indication of that with the visitation and reentry guidance coming out together the last week in June. But no question, Rosemary, there's a lot more to be done. The data makes that clear.
Yes, I'm really, really concerned about this. And the other question that I have in your statistics at the beginning, I'm wondering if there is a possibility to provide information on cases and possibly death of people who have contracted the virus and have underlying conditions. I am in the age group of 80 plus. So I live at home. I don't have underlying conditions, and I'm wondering whether my family is ostracizing me unnecessarily because they're worried that they are going to make me sick and then I'm going to die. So I'm wondering whether that is a possibility to see, or for any age group, how many people have contracted and have underlying conditions. I think that would give us some information on how this virus works. Thank you.
Thank you, Rosemary, and you are exactly echoing the conversations that we're having with CDPH and agency around when you have 45% of the deaths 80 over. We need to do much more understanding of that population. Are they people living in congregate settings or living at home? Are they living alone? Are they living with multi-generations perhaps who are in essential work? Do they have underlying conditions, as you said, or not? Do they have social determinants of health issues that are putting them at greater risk? So we are striving to learn more here in California, and with, of course, national and international researchers as well. We are trying to get, and we will get more data on disability and more data on congregate settings and race. So all of that is absolutely in the works, and we received a directive from the governor's office yesterday that all data must be transparent and shared, and so more is coming on that front from all departments. So we absolutely agree. We need more so that people can, both the state and locals can do interventions, but so people and families can risk assess and manage this over the months to come. So we hear you. I'm going to note, Maria, that we have 5 minutes and 5 hands. So let's see what we can do to whip through this.
Absolutely. Cheryl Brown, you're up next. Your line is open on our end.
Okay, I've unmuted myself.
Yep.
Thank you so much. And again, I don't want to take my minutes to give it to you for all the wonderful things you're doing, but you're doing great. I wanted to talk about the long-term care benefit that we're talking about. It seems that there's no the aging. Our commission has lots of questions, and we've sent them in. But can you tell us or give us any more information about this? I know we brought the issue up in the master plan, but we were so surprised when we saw it in a budget item. So we didn't know what was going on. Can you probably explain that a little bit more?
Yes, the good news is the next subcommittee meeting is Friday afternoon, and there will be much more detail provided. There are more documents coming close to being released from our colleagues at DHCS. I will assure you not every question will be answered, not every detail, but the detail that people need to engage in the more robust conversation. More is coming out before that meeting on Friday, so we can have a more substantive conversation and then continue to have questions and go further. But yes, we recognize that more information is needed to move, and more time as well. So more coming soon.
Thank you.
Fantastic. And next we have Jane Jarlsberg. Your line's open.
Okay, can you hear me?
Yes.
Cool. I'm a senior affairs commissioner from San Bernardino County. I live in small town of Joshua Tree. And I'm missing a meeting. I'm the chair of the intergenerational committee of the commission, and I'm missing that meeting right now to attend this meeting. I have 2 concerns as a living in a small rural community, and I have lived in Mendocino County in a small rural community. I'm concerned about access to healthcare, good healthcare for seniors. It's terrible. It's hard to access. Transportation is difficult. These are a number of issues I haven't really heard addressed for rural communities. I'm also interested in help for grandparents who are currently caregivers for their grandchildren. That's a particular concern of my subcommittee for the commission. These are 2 things that I haven't really seen a lot of specifics addressed. I'm hoping that it will be.
And are you speaking, Jane, more about the COVID moment or the master plan, or both?
Master plan.
Yeah, great. On healthcare in rural, there has been, I would say some, not enough discussion, but we've had good participation from Humboldt County leadership, of course, Patty Berg, and Nevada County as well. We are planning to do a remote forum, virtual forum with Jim Wood in that area. Health, this is absolutely a huge concern, the cost and the access to healthcare. I will say there is some question whether the breakthrough in telehealth that is happening because of COVID, that could be part of the solution if it is accessible, if it is affordable, if there is the infrastructure. I mean, many important ifs, but yeah, those are that's part of the conversation. And then of course, trying to move more of home and community-based services to be statewide is also part of the conversation. On grandparents and caregivers, I do think we need more on that. It's something we've had some conversation with the First Five Commission around about making sure intergenerational caregiving and connection is valued in every way. So if you had recommendations on that from your intergenerational work, we would, consortium, we would welcome that. That is something we want to highlight more and more, and especially is a huge issue right now with physical distancing, with the issues around schools reopening, essential workers, it couldn't be more timely. So thank you for raising it.
Okay.
I just want to acknowledge it's 11 o'clock. I know we have lost our captioner and I apologize for that. I am happy to, Maria, stay on for a few more minutes to take the remaining questions if we could close the queue and just run through the list. And I recognize that people have back-to-back meetings and may need to go, but I'm happy to finish out the queue.
Fantastic. Carmen, you're up next. Carmen, I'm unable to mute your line. I think you're using an older version of Zoom, so it's giving me an error code. If you want to go ahead and email your question to olpa@aging.ca.gov, I'm sure we'll get to it. Will Tift, your line's unmuted.
Hi there. Can you hear me now?
Yes.
Yes.
Great. Great presentation today. Lots of stuff packed in to a short period of time. I'm wondering, Director Wade, do you think we've come to the end of traditional congregate meals? And if so, what are the fiscal and program implications of that for nutrition providers?
Well, I think we are certainly in the world of temporary alternative services, and that we'll be doing home delivered meals for the near future, the foreseeable future, shall we say. And so all the work that you and the other networks have done to move to home delivered meals is vital and continues to be vital. I think that is part of the redesign and imagination challenge the Aging Network is bringing forward. Is what does a senior center look like in the future? Are there will always be nutrition needs, there will always be social needs. It's always great to come together and learn and exercise and support each other. And so what does the community center of the future look like that allows that supports health, that supports intergenerational connections? I think there will be time to, while we are on pause from congregate meals, to think about how we bring forward what's a strength of that proud history and what is an opportunity to redesign. But in terms of program planning, I think we are not going to be doing congregate meals for any time soon.
Okay, and I think our last question, you're listed as MSSPJFS. That might be an organizational name.
Yes, we know them. Welcome.
Your line's open. You may have to unmute. There should be a kind of a microphone icon at the bottom of your toolbar. Should be at the bottom. I don't know. Kim, I don't know.
Let's do an email on this one too. I believe this is our MSSP provider, Jewish Family Services. So we're happy to connect.
Fantastic. And I think that's it for folks in the queue.
Okay. Thank you so much for the additional 3 minutes. Thank you for the great ideas and great questions, and most of all, the partnership as we chart this new path together. So grateful, and please be well, please take good care and stay in touch. Thanks again.